Hello, everyone. It's nice to be with you. Today, we are going to focus on imaging evaluation of breast implant. Here is the outline of this talk. So we are going to start talking about breast implant type, and then we are going to review the abnormal and normal appearance of a breast implant on multiple breast imaging modalities such as mammogram, ultrasound, and MRI. And later, we are going to discuss the ACR guideline on evaluation of breast implant integrity. And finally, we are going to finish up discussing the breast implant associated cancers. I'm going to use a lot of questions to go on the cases to present the breast implant integrity evaluation, because I believe that is the very active and efficient way to learn for me and also for my residents. All right, I think most of them got it right. The correct answer is C. Breast implant is associated with non-Hodgkin's lymphoma. It's not associated with connective tissue disease, breast cancer. Let's just briefly talk about the history of breast implant because it's interesting. So very first, the breast silicone implants were developed by two plastic surgeons from Texas in 1960s. Before that, people just directly inject the silicone gel or paraffin to people's breasts for augmentation. And then this two plastic surgeons developed this silicone implant. This whole story is filmed in a movie named Breast Man back in 1997. However, there are lots of rupture and other adverse events associated with the silicone implant. So that's why FDA banned silicone implant in 1992. FDA didn't lift the restriction until 14 years later, when after the better material for the implant shells was developed. So now we are using the fifth generation of the silicone implant. And in United States alone, more than 3.5 million women have a breast implant. Most of them are very young. 70% of the patients are less than 40 years old. And there is big money involved in this. Another question. What kind of implant does this patient have based on this envelope view? All right, let's see your answer. Okay, it's everywhere. Let's just review it. The correct answer is D. It's retropectoral saline implant. So let's figure out the location first. Here is the pectoralis muscle over here, right? As you can see that this implant is behind the pectoralis muscle. So it's a retropectoral implant. So what's the composition of the implant? There is a part over here. Normally saline implant has this part for injection. So this on this envelope view, there is a retropectoral saline implant. So it depends on the composition, location, and the lumen type. They are all different kinds of implant. Silicone implant is more common than the saline implant. And other than retropectoral implant, we also have a retroglandular implant. Means that the implant just directly behind the fibroglandular tissue before the pectoralis muscle. And it could be single lumen, could be double lumen. But single lumen is much more common than the double lumen. Also remember that breast implant is not a lifetime device. The average lifespan for implant is approximately 30 years. So there are more imaging of breast implant on the mammogram. On the CC view, you cannot tell the difference, but on the MLO view, you can tell the location. That's the one we just reviewed. That's also another saline implant. They have a part over here. This implant is behind the fibroglandular tissue before the pectoralis muscle. So this is a retroglandular saline implant. Again, those are the saline implant at two different locations, behind the pectoralis muscle and behind the fibroglandular tissue over here. Sometimes on the imaging, you can tell that the silicone appears more dense on mammogram than on the saline. This is another clue. You can tell, the different composition of implant. Another question. 35-year-old woman presented with a palpable concern in the right breast. I gave you the mammogram and ultrasound. What are the appropriate assessment and recommendation for this patient? So let's see your answer over here. Okay, you guys all got it right. This is so wonderful. Let's just review it together. And so based on this imaging I provide for you, you know that this is a saline implant, and there is ultrasound that shows a structure very organized over here, right, on the anti-radial view. And then you turn your probe around, and then you found this one is so well organized. That's exactly what the part look like. So just let the patient know that what you feel is this the implant part. You don't need to worry about that. So what are the common breast implant complications? If you read online on the FDA website, there are lots of potential complications associated with that. Today, let's just focus on the most common ones. So immediately after the surgery, patient can have a hematoma or infection. And then later after surgery, like a month or years after surgery, patient can develop capsular contraction or implant rupture. In this lecture, we are going to focus more on implant rupture because it's more common complication. So it's very important to make an early and correct diagnosis of implant rupture, especially the silicone implant rupture for the radiology, right? Because silicone implant rupture is kind of difficult to diagnose in clinic. If you miss the diagnosis, the silicone will come out of the implant and then get into the breast parenchyma and goes to the lymphatic system. And it will be very difficult to surgically remove those extracapsular silicone. That's one case. On the other side, if you overdiagnose the implant rupture, it can also cause a problem. For example, there is no implant rupture over there, but you call it, and then you prompt the patient to go to the OR for surgical removal. You can imagine what trouble it can cause, right? It will be overdiagnose that. Let's look at a few normal and abnormal implant appearance on the imaging, especially on mammogram, ultrasound, and MRI. Look at the let's start with the question: which statement about the mammography and the breast implant is true? All right, let's see the answer over here. So the answer, most of you choose number D. Let's review it together. The correct answer is D. Implant displays views miss part of the breast tissue and increase radiation dose. So ACR still recommend mammogram and with imaging with implant displayed views for screening. Here are the implant display views. You can see that you can miss some tissue around the breast implant, right? But there is no recommendation on the supplemental screening for that. So let me just show you an example how a cancer was missed on the implant view, but detected with the implant displaced view. You can see that there's a cancer. You can see it very well on the implant displaced view, but you cannot see it on the with implant view over here. And then later on, we performed ultrasound. It was confirmed invasive ductal carcinoma. So mammogram is the most common and most cost-effective modalities to evaluate the breast. It can detect the saline implant ruptures, and it's also very useful to detect the extracapsular silicone rupture. For the intracapsular silicone rupture, mammogram is not very sensitive. Let's just look at the example. This patient has a saline implant rupture on the right side. As you can see that, the ruptured saline just absorbed by the breast, and then the envelope, the implant just shrank and stayed over there. And this is the actual capsular silicone rupture. It's no difficult for us to see this silicone get out of the implant envelope over here and over there. You can see that this implant is quite old. There are lots of calcifications associated with this capsule over here. So that's the implant. This patient had an implant rupture. The implant was removed. You can see that the silicone implant, the silicone gel just stayed in the breast forever. If you try to remove that, you can see that the surgeon will cause a loss of deformity of this breast. So lots of times they just let it stay over there. Sometimes it can also go to this lymph node. So don't be confused with calcifications and recommend biopsy of that. So that's the mammogram. How about the ultrasound? Ultrasound can be used to evaluate implant rupture also when compared to the MRI, because this is faster and cheaper and easier. And because when patients have implant rupture, they often present with mass or pain. And in that case, you can start with ultrasound. The sensitivity of ultrasound is better than the mammogram, but not as good as the MRI. The negative predictive value has a big range. It's from 50 to 19%. Question: was this sign of ultrasound normal or abnormal? Let's see your answer over here. Okay, we have a little bit of step. We are maybe kind of confused with a step off and the step ladder sign. All right, let's review the results. So the correct answer is A. This is a step off sign. This is a normal silicone implant ultrasound on the edge of that. All right, so that's the again, that's the silicone implant at the edge of the implant. You can see the step off sign because the sound travel much slower in the silicone gel than in the normal breast tissue. That's why it generates this kind of like step off sign. It appears that the silicone located further away from the probe because it travels slower and they take more time to get back to the probe. And that the ultrasound, it often is featureless. It could be anechoic. And they also have those kind of like a trilaminar sign. This is the inner side. This is the inner envelope, the shell of the implant. And here is the fibrous tissue developed around the shell. That's the space between that. You can find this on both the silicone implant and also the saline implant. Saline implant, just like a cyst, right, is a bag of water. So it's often anechoic. They don't have this peripheral step off sign. Question: what's the most reliable ultrasound sign of intracapsular rupture? The correct answer is the step ladder sign. I saw half of you guys select the linguini sign. Remember that linguini sign is an MRI sign, it's not ultrasound sign. Okay, let's the early signs of intracapsular rupture on ultrasound is described as a keyhole and loose sign and the subcapsular line sign and loss of this normal trilaminar line over there. And later on, as it's advanced, it will develop this step ladder sign like that. It's very disorganized shelf over there. This trilaminar line is disrupted over here. Remember that patient also can also have this reticular fibrillation artifact. This normal saline also have this kind of like a parallel line over here. This is not a step ladder sign. This is just the artifact over here. You can tell that these lines are parallel to this shelf over there. What's the reliable sign of extracapsular rupture of the silicone implant on ultrasound? Now we are asking a question on silicone implant. All right, so all of you guys get it right. This is great. It's a snowstorm. Silicone, once the silicone gels get out of the envelope, they have various appearance on the ultrasound. It could be a hyperechoic, intermediate, or anechoic over there. Like this one, you have this snowstorm sign over here, and then over here is get kind of like an anechoic. And this one is a silicone granuloma. Over here is giving you heterogeneous architecture over here. So MRI is very sensitive and specific to evaluate the silicone implant integrity. And what are the MRI techniques we use to evaluate implant? So we definitely need the dedicated breast coil, and magnetic fields need to be more than 1.5 Tesla. And remember, no IV contrast is different from the typical MRI screening or pre-op evaluation. We will also need a STIR and T2 sequences to either enhance or suppress the signal intensity from implant or water. For the silicone selective imaging, the silicone will be bright and the water will be dark. On the contrary, for the silicone, on the silicone saturated imaging, and the water will be bright and the silicone will be dark. Other than these two sequences, to either enhance or suppress the silicone and water signal intensity, we also need two different planes. One is the axial plane, one is the sagittal plane. Here are the imaging examples for implant evaluations on MRI. Here's the STIR imaging for silicone bright. You can see that the silicone are very bright. And this is a silicone saturate imaging, silicone are dark. And this is a T2 weight imaging. And this is a sagittal imaging over here. And the silicone is bright. Question, what's the most reliable MRI sign of intracapsular rupture? All right, this is great. You guys all get it right. Again, the ingredient sign is the correct answer, and the ingredient sign is for MRI. Step ladder is for the ultrasound. So for the intracapsular rupture, and it can show as a keyhole sign or subcapsular line at the early stage, and later on it can present as an ingredient sign on the MRI. And intracapsular ruptures is more common than the extracapsular rupture. This is how it look. One of the examples of the intracapsular rupture, and then the capsule over here actually is still intact over there. Here is the radial fold, which is normal. You can see it on the sagittal view. At the beginning, you may think about if you just look at the axial imaging, you may think, hey, that could be a intracapsular rupture and present as a subcapsular line. So always look at the sagittal as your cross-reference. Here are the extracapsular rupture signs. You don't need remember all this name of the signs, you can tell if this gel, silicone gel come out of this capsule, like this one, or there's a subtle, you have no problem to call it. And there's another one is more dramatic. A lot of gels just come out of this implant capsule. And remember that sometimes you can see this granuloma on the MRI with contrast, and the silicone granuloma can enhance just like the breast cancer, like in this case over here. Okay, another question. Breast expander is a contraindication to MRI. What's the least likely reason? All right, all of you guys got it right. Let's review the breast expander. Breast expander is a device surgeon used to place in the mastectomy bed to stretch the overlying skin. It's often used for the patient with cancer and then had the mastectomy, right? It has a metallic port and also magnetic markers. They use that for needle localization and access for sequential saline injections so that they can gradually and stretch the overlying skin. And it is contraindicated to MRI because the metallic port can generate overheating, and the tissue expander can be displaced, and also the marker can be demagnetized, and later you cannot use that. We have reviewed this normal and abnormal appearance of breast implant on mammogram, ultrasound, and MRI. Now let's look at some cases. Case number 1. 48-year-old presented with breast pain. She was beaten up by her husband. She's concerned about breast implant rupture. And I'm just showing you her mammogram 5 years ago. She has no recent mammogram. So what's the appropriate initial imaging evaluation for this patient? All right, let's look at it together. The correct answer is actually mammogram, because we say that the patient has, based on the imaging, you know that the patient has a saline implant, right? Mammogram is very good to detect the saline implant rupture. So mammogram were obtained, and what's the appropriate next step? Okay, we are everywhere, and let's take a look over here. The correct answer, I think, is ultrasound at this point, because the patient is supposed to have a mammogram. He had a mammogram before, but why we cannot see this mammogram over here? Since the patient is already over here, in this case, we can just do ultrasound. So ultrasound was performed. What's the most appropriate management? Okay, this one, I think we can just go with clinical management, because we know that this is the implant rupture over here. There is disruption of the trilaminar line, and this is the step lateral sign over here. We identified this saline implant over here, residual one. And so I think the best way to manage that will be for the patient to go back to plastic surgeon. If a patient continue to have a pain, they may have to remove that. I know in some cases, the patient just has no, no pain, no other symptoms. They don't mind this deformity and the asymmetry in both breasts. So I think it's better for the patient to discuss this with her plastic surgeon. Okay, what's the most common clinical presentation of the implant rupture? I think almost all of them get it right. The most common clinical presentation is contour deformity. And if a patient has a saline implant, normally they have a very dramatic presentation. They can notice this kind of like a deformity and asymmetry in both breasts. And if a patient has a silicone implant rupture, it's often quite subtle. But anyway, based on a study performed by TARC over here, and contour deformity is the most common clinical presentation. And of course, the patient can palpate or feel mass or pain or other symptoms. So this slide, we are going to talk about ACR recommendation for evaluation of breast saline implant integrity. And it depends on the patient's age, implant type, and symptoms. If a patient has no symptoms, there is no imaging screening recommended by the ACR. However, if a patient has presented with symptoms, and we need to recommend different initial evaluation, imaging evaluation based on patient's age, but no MRI for those patients. For example, if the patient is less than 30-year-old, and we recommend ultrasound as a starting point. For patients older than 40-year-old, mammogram should be performed. Like this case we had before, right? That patient has a saline implant rupture. We start with a mammogram. Because she is more than 40-year-old. For the patient between the 30 and 40-year-old, you can either start with a mammogram and ultrasound. So no MRI needed for the saline implant evaluation. That's case number one. Let's look at case number two. A 59-year-old woman felt a painful mass in the right breast, and a mammogram is performed over here. She says she has a history of a breast implant augmentation at the age of 24. So what's the best imaging evaluation for this condition? Actually, in this case, we don't need to do the ultrasound because we already know that it's actual capsular rupture. We need to do the MRI without contrast because we know that the implant is quite old. Patient already told you that. You also found the calcification around the capsule. You also worry about the contralateral breast. So for this one, I would recommend MRI without IV contrast. And how about the silicone implant evaluation? What's the MRI recommendation? For the asymptomatic patient, again, ACR recommend no imaging. For symptomatic patient, ACR recommend MRI. They think that it is appropriate for symptomatic patient of all age. But alternatively, you can maybe use the ultrasound or mammogram, depends on patient's age. And I would like to point out that FDA have different recommendation from ACR, and FDA is keeping updating the recommendation. In 2019, FDA recommended MRI screening should begin between the 5 to 6 years post-surgery, and they should be done every 2 to 3 years afterwards. For a symptomatic patient, if MRI is not available, ultrasound can be an acceptable alternative. That's 2019 what they recommend. And then 2020 last year, they also add recommendation for patients with symptoms. They recommend MRI at any time post-operatively for symptomatic patient or patient with equivocal ultrasound. Okay, case number 3. 60-year-old woman with screening mammogram. What's the most appropriate recommendation? This one is pretty subtle. The correct answer is MRI without contrast. Why we recommend that? Because on the mammogram, you can tell that this patient has some undulation of this silicone implant on the right side. Also, she has no symptoms, and you can tell there's a calcification around this implant. So it's quite old. There's with the undulation. So we will worry about intracapsular rupture. So we recommend the MRI without a contrast. And what's your diagnosis based on this MRI? Yes, you guys are definitely right. Those are the intracapsular rupture. All right, case number 4. 38-year-old woman with bilateral breast pain and deformity. She had a silicone implant 4 months ago, and the MRI is performed. And what's the most likely diagnosis? I just would like to point out that you may think it's a capsule, subcapsule line, but it's not. It's radial fold, like I showed you before on the sagittal. So don't be confused. The diagnosis is not here. Let's look at the answer together. The correct answer is implant capsular contraction. And you can see that there is a significant deformity in the breast over here. Patient can notice that, and also patient just had has a both breast pain. So what is a capsular contracture? It's an abnormal constriction of the fibrous capsule around the breast implant. Like if you talk about the encapsulation process, sometimes the fibers are just too tight and then that constrict this implant. It can occur at any time after surgery, but most commonly within the first few months when our bodies respond to these foreign bodies, right? And the report has shown that it's more frequently observed with a smooth surface silicone implant and also subglandular implant. This is a clinical diagnosis, and a lot of time patient and the surgeon will notice this deformity, and it's quite painful and may look inflamed. Another thing I would like to point out is gel bleeding. Gel bleeding is not implant rupture, and often patient has no symptoms. We just found that on the screening mammogram, a lot of time is in the X-ray lymph node. So what happened over there is the silicone gels just get out of this membrane of the implant membrane and get into the breast parenchyma. A lot of times they are transported through the lymphatic system to the lymph node. So again, it's not implant rupture. If you saw some snowstorm ultrasound in the X-ray lymph node. Lastly, I would like to briefly talk about the breast implant associated anaplastic large cell lymphoma. So it is a real T cell lymphoma or non-Hodgkin's lymphoma. The incidence is very, very low, and it's not recognized as a new entity by WHO until 2016. But because the data is limited, so our knowledge on this is still evolving. In a lot of reports saying that it's more commonly in patients with a textured implant. Okay. Patient can present with symptoms of tightness, pain, or lump or swelling of the breast while the peri-implant fluid develops. It can occur months or years after the surgery. But make sure that the patient has no erythema, warmth, or skin thickening. With that symptoms, a patient can have either infection, inflammation, and or inflammatory breast cancer. So we need to be very careful when we evaluate this patient's symptoms. Early recognition is important, and it can be diagnosed with fluid analysis after you aspirate some peri-implant fluid. The management should be complete surgical excision after the accurate diagnosis depends on the stage. Systemic chemotherapy and radiation therapy can also be used for these patients. I believe this is the last question. What's the most appropriate initial imaging recommendation for suspected breast implant associated cancer by ACR? The correct answer is actually D. Ultrasound is recommended for patients of any age with any type of implant. I know lots of you choose A. I think in practice, in real world practice, a lot of physicians just order MRI. Anyway, so let's take a look at the ACR appropriateness criteria over here. So that's the ACR appropriateness criteria. I directly copy from the website. They say that ultrasound breast should be the initial imaging evaluation for the patient with suspected anaplastic large cell lymphoma, regardless of the patient's age or implant type. If ultrasound is equivocal or non-diagnostic, you can perform the MRI because, like we just talked about, very often those anaplastic large cell lymphoma present as peri-implant fluid. When you detect on the ultrasound, you will do the ultrasound-guided aspiration and send for fluid diagnosis, right? If the results come back as negative, you're still, concerned about the lymphoma, then you can perform an MRI without contrast, because sometimes this lymphoma can present as a mass, which can be detected on the MRI without contrast.